Bathing decreases the possibility of infection by removing excessive debris, secretions, and perspiration from the skin. It also prevents odor, promotes circulation, and provides comfort for the client. To complete this exercise, you will need the following: a basin with warm water, soap and a soap dish, personal articles including deodorant, powder, and lotion, a laundry hamper, towels and washcloths, clean gloves, bath blanket, hospital gown, and an adjustable table. Because you will be using a mannequin for this exercise, ask one of the lab TAs if it is necessary for you to use water.
Hi, I'm Chris. I'm going to give a demonstration on how to do a bed bath with a person in bed. First, I'm going to put the side rail down on the side I'm working on and raise the bed so that it's at a good level for me to work. Okay. I'm going to use gloves during the process. So I want to keep the client covered the entire time, so I'm going to spread a bath blanket over the patient. And at this point, you can ask the patient to hang on to the bath blanket here while you pull the linen down underneath. And I'll untuck the linen so I can roll it into a ball here. Next, I'm going to take off the client's gown. Make sure it's untied around the neck. And again, have the client hang on to the bath blanket while you remove the gown underneath. And it's always good to keep your dirty linen out of the way. So I'm going to have a dirty linen hamper handy to throw my linen away. At this point, I'm ready to expose whichever part of the client I need to bathe. So I'm going to start with his head and face. If the client's able to tolerate his head being down, I'm going to remove the pillow, set that aside, and place a towel underneath his head. Then I'll grab a washcloth, use soap and water, soap if the client wants soap, and begin to wash his face. Don't use soap around the eyes, but when you wash the eyes, it's important to start from the corner close to the nose and work out. Do the same on each side. Wash around the mouth, around the ears. And it's important to wash and dry areas of the neck since there might be skin folds here. Make sure all skin folds and wrinkles are dry. If the client would like their hair washed, you can use a hair washing cap to wash the hair. After the head is done, you can put the pillow back for the client. so they're comfortable for the rest of the bed bath. Now you can expose each arm and wash each arm. When you wash the arm, you hold the arm up, begin with the wrist, and work your way towards the body. This distal to proximal motion from the hand towards the body will promote venous blood return. Then as you wash and dry the axilla, and then we will repeat with the other arm. At this time, you can apply any powder or deodorant underneath the client's arm. Then I'll expose the client's chest. And wash the chest. On female clients, be sure to get under each breast and dry under each breast. And cover them back up. And it's okay to bring more than one towel and washcloth so you can switch on each body section. Next we can work on the client's legs. Same idea with the legs as washing from proximal, distal to proximal. This is also a good time to inspect the client's heels for breakdown and wash the client's feet. Be sure to wash and dry thoroughly between the toes. For the client's feet and hands, sometimes it's a good idea to have a basin of water and to dip the client's hand in the water and then wash it in the water. Same thing with the feet. If the client's able to bend his leg enough, dip the client's feet in water, or have them sit in a chair and put their feet in water and wash them or soak them if needed. And we can switch to the opposite leg. Again, be sure to get thoroughly between each toe. Now, on a client that is able to roll themselves, this is a good time to wash their back. And a client that can roll themselves, you can ask them to hang on to the opposite sidebar and simply roll over. And a client that can't, you may want to have a partner on the opposite side of the bed holding the client there while you wash the back. And I'll start towards the head, wash the back of the neck and the back. This is a good time to perform back massage if the client desires. Wash and dry as you go. wash the client's rear, and then wash around the butt with a new part of the washcloth. And be sure to dry thoroughly. Okay. Have them roll back over. And we'll end with the perineal area and expose the client. And for females, be sure to wash front to back and use a different part of the cloth each time. And be sure to remove any dirt or debris you see. And thoroughly dry every skin fold. Again, with a different part of the cloth each time. With a male client, be sure to pull back the foreskin on the uncircumcised male, wash and dry, and then replace the foreskin where it was. And be sure to wash all the skin folds around the scrotum and the perineal area, and dry every skin fold as well. After that, you can have a clean gown ready, and you can dress the client or ask the client to help dress themselves underneath the bath blanket. Once the client's new gown is on, you can remove the bath blanket and put on your new linen for the bed. That's how to do a bed bath.